but if I compress you front to back and I tip you forward, ER space goes that way. Good morning. Happy Wednesday. I have Neuro Coffee in hand and it is perfect. All right. So it is Wednesday. That means that tomorrow's Thursday. So 6 a.m. Thursday morning, Coffee and Coaches conference call as usual. Always a great group of people, always great questions. Please join us for that. The link will be on my professional Facebook page prior to the call. Okay, today's Q&A is with Luiegi. We've talked to Luiegi before, and he brings up a really, really good question I think is actually quite common. When you have one of those clients that presents with a rather significant reduction in access to both ER and IR, so both losses of external rotation and internal rotation to a rather significant degree. It's like, well, what do you do with those people? And so, number one, we went through the representation so we understand that. Basically what happens under those circumstances, when you have the anterior-posterior compression, you have anterior orientations, all of your external rotation space disappears. And so it moves outward. And so we have to consider that when we're making our exercise selection so we don't drive them harder into compensatory strategies. Then we talk a little bit about some of the activities that we might choose. Threw up a couple of representations there to overlay it on the video so you have an idea of what we're talking about. So I think this will be a pretty useful Q&A for a lot of folks. If you would like to participate in a 15-minute consultation, please go to askbillhartman@gmail.com, askbillhartman@gmail.com. Put 15-minute consultation in the subject line so I don't delete it, and we will arrange that at our mutual convenience. Everybody have an outstanding Wednesday. I will see you tomorrow morning, 6 a.m., Coffee and Coaches conference call. Good. Have a great day. All right, the return of Luiegi. How are you?
Good, Bill.
Clock has started. What's your question, man?
All right. So thank you first and foremost for letting me ask this question.
Of course.
And my question is pertaining to a client I have who has like a lot of pain on his right knee. And I'm just trying to figure out what to do with it because it's like really aggravated when he's coming down from like a step up. And I was trying to fix like some anterior pelvic tilt because of what you recommended for like to do a supine step up cross connect.
Mm-hmm.
And pretty much I just want to figure out what to do with that. He has really bad or his chessboard is this. I'll show it.
Okay, hang on. Stay right there. Oh, okay.
Yeah, it's not the most accurate, but
yeah, you don't have a whole lot of anything, do you?
Yeah, of like the range of motion.
Yes.
No.
Yes. Okay. All right. So you can pull it down. All right. So you don't have any ERs or IRs. So you got an anterior posterior compression. You've got an anterior orientation. Okay. And then anything that does appear to be even remotely close to normal is being measured away from midline. Okay. So like, how do you get hip flexion when there's no external rotation? Well, because you're measuring it off to the side. So let me show you what I mean. So this would be, in early hip motions, there's a space where external rotation occurs. But if I compress you front to back and I tip you forward, ER space goes that way. So it goes out to the side. And so anything that you have that's magnified. So if you got, what do you have, like 100 degrees of hip flexion on there? Did I say that right? Did I see it correctly?
Yes, about 105, 120.
Yeah, there's no way this person can break 90 degrees. Okay. So then you're measuring away from midline. So this would be an individual that would typically favor, like they prefer a wide stance squat versus a narrow stance squat. Am I correct?
Yes, his feet definitely turn out, and then
yeah. So they have to do that because that's the only space that they have to work in. So when you ask somebody to step up, okay, and they're facing straight ahead, you put them in a space where they immediately go into some form of orientation. And then they'll immediately try to produce internal rotation. So now I've magnified the amount of force that I'm applying to the ground. So you're putting them in a space that they do not have access to, okay? Without compensatory strategies. Yeah. So again, you've increased the anterior orientation, you've increased the spinal rotation, which means that you probably also increased the amount of rotation at the knee. to create the internal rotation downward. That could be why they're experiencing this knee pain. Okay, so this is going to be somebody that has a lot of work to do to recapture some space, so you can start to work in those directions. All right. So chances are, think about this. Would you try to front squat them with a hip width stance? They probably
Probably
can't.
not.
They
Yeah.
probably can't do that, right? Because it doesn't look right. Correct. So they're using compensatory strategies to get their leg in front of them when you ask them to do a step up. So let's take those activities that are straight ahead. Let's just take them off the table. Okay. But let's start to access the spaces that they do have. So, based on your hip measures that, okay, for some reason I can capture a lot of hip flexion, but that's a turn. They're already turned, they're turning. And so they're accessing the space that they can access. Yeah. So now you're looking at like a flatter kind of orientation. So if these are the feet, this is how they like to squat, right? So like the squat with wide stance, feet turned out. So let's put them on staggers in this front to back orientation where they actually do have space. So they're going to be the people that like I said, sled drags are really good, like sideways sled drags, because you're keeping them in the spaces that they can actually access, right? The chop and lifts that we talk about in a wide stance, staggered position are going to be more useful because you're keeping them within that space. These are people that I tend to put on the ground and I roll them to try to create the shape change that I need to access that forward space. And that's going to be a little bit more of a time-based kind of an adaptation, but that's where you're going to have to start with these people. Because again, what you don't want to do is push them into spaces that they don't have available to them, because what you're recognizing here is the compensatory strategy. And they have just decided that, okay, I'm going to use my knee, right, a little bit harder. I'm going to put more pressure through my knee to create the IR into the ground, right? And then maybe they're orienting their pelvis as they do that. Maybe they're changing their spine orientation to create that down force, and now they load the knee. Now, what's your background as far as your qualifications?
Kinesiologist.
Okay. Do you typically work with people that have pain?
Typically, yes.
Okay. And so that's part of the qualification?
Yes.
Okay. All right. I just want to be sure, because again, some coaches and trainers really aren't well versed in trying to manage those cases. If you need to bring somebody else in that can help you, like if you need, you don't do joint mobilizations then, do you?
No.
Okay. You're just the exercise side of things, correct?
Yeah, mostly.
So, okay. If you need help, call up a chiro or a physio that can help you make some of these changes. Because what you don't want to do, especially if you make all these adjustments and you're still having issues with pain, you gotta start to bring in some other people. Yeah. Don't try to manage it by yourself, because again, you get somebody's hands on them, they can help you make some of these changes that you need, and then you've opened a window of opportunity for yourself to expand the repertoire, so to speak, of the activities. Okay. Yeah. How was that?
Yeah, that's pretty good. I'll definitely ask around for, I know some RMTs, registered massage therapists are here in Canada, so I'll ask them for that. What did you mean by rolling them when they're on the floor?
So literally rolling them on the ground. Axial, so long axis rolling, right? So that the axis is through the top of your head, and so you're going to actually roll them. So with especially with wider people, okay, there's no muscles on the side that effectively squeeze you well enough to overcome the anterior posterior compressive strategy associated with physical structure or training. And so using the ground as a stimulus to push against the sides of your body, and then your body weight pushing down, we actually get an anterior posterior expansion. So you get a shape change through the pelvis and the thorax when you do that. So imagine just laying straight up and down on your side and then moving through a very small arc of motion. So when I talk about like some of the armbar progressions where you're in side lying or just plain old axial rolling, does
Okay.
wonders for people as far as the shape change is concerned. And so if you ever check, you ever check range of motion directly? You do like a
Um,
direct measure of like an ER and IR like you do on a chessboard?
yes.
Okay. So do your like hip or shoulder measures, roll them, and then recheck your measures. And what you should see, if you were effective, you should start to see those measures start to expand. And that gives you more space to play with as far as your exercise selection. So instead of having to stay way out here where they're oriented in the ER, you can start to work them inward. And then you capture more turn, and then your exercise selection starts to expand because now you can bring them into this front to back orientation, whereas before they're just kind of spread out.
Everything's away from the midline is what you.
Everything's away from the midline. Yeah, based on your chessboard. Yeah, that's what you're looking at. Yeah, very
So
small space out to the sides that they're playing in.
can it just have them lay on the side and kind of just like turning a bit and maybe
Uh-huh.
add weight on them, like put
So,
like.
a nice little thing to do is you put them in side lying. You give them a very, very light dumbbell or kettlebell, and you do like just the side lying portion of an arm bar. So you can superimpose the ER and the IR, and what happens is you're driving the turn from the hand proximally. They're weighted on one side of their body into the floor, and so you're creating this alternating expansion front to back. You drive breathing with it. So as they internally rotate, you exhale. As they externally rotate, you inhale. And so you're literally creating. So if they're like this block that doesn't turn, what you do is you start to turn them gradually. Right. So you don't need to force this kind of stuff. It's like let the ground do the work, let the breathing do the work, and let the extremity motion drive towards the center of the body. So I always describe it as twisting and untwisting a towel. So if you ever twist a towel tight, it's like, so you twist it one way, it tightens, and then as you go through the middle, it loosens, and then it tightens in the other direction. So we're the same way. We do the exact same thing, right? So I drive compression, expansion by driving the internal rotation and external rotation. I drive the breathing to create the expansion and compression as well. And you get a nice little big bang because I got the floor that's helping me change shape. I got the breathing that helps me change shape. And then I got the twisting that helps me change shape.
To elaborate on that, is that you're on the shoulder, like the ground
on your
is
side.
on the shoulder, on the side.
They're just side lying.
Inhaling,
So if I'm laying
exhaling.
on my left side, I just hold my arm out to the side, and that keeps me propped on my side. And I'm just going to turn into and away a little bit at a time, very gently, very gently. You don't have to be aggressive with this stuff. In fact, you don't want to be aggressive. So you don't use heavy weights.
Sure.
You don't drive aggressive breathing with people that are already compressed, because I want the expansion. Right. So again, it should feel fairly gentle as far as this whole thing is concerned. If you hear the the guttural noises of people that are holding their breath and then having trouble breathing through it, it's probably too hard of an activity. So in that case, you take the weight out of their hand and you say, okay, we're just going to gently roll back and forth. And I want to make sure that you breathe in and breathe out and breathe in and breathe out. Okay.
Okay, cool. I'll start off with that.
Yeah.
And then just keep it again, like what you said, keep it away from this front, like sagittal plane area.
Right. So again, it's the front to back stuff that's probably going to create more of the orientation. Doesn't mean you can't get there. That's the thing I want you to recognize. Is like you're not stuck out in this wide space forever, but you got to gradually bring them in, because if you do it too fast, you get pain.
Yeah,
Makes sense.
Sure. So does that cover the pelvis as well when you're rolling on your side, even though it's just for the arm, the pelvis will also. Okay.
You're putting weight on the pelvis through the hip. So you'll get a change there too. You can actually exaggerate that a little bit. So what I will occasionally do is I'll take like a fairly thick, firm towel roll. I'll place that right underneath the ilium and have them roll across that. So there's just a little bit more upward pressure. Ultimately, that can turn into a foam roller where you roll the pelvis across the foam roller, but you got to work into that. You go too firm, too fast, and people don't like you very much because it's a little sensitive.
Yeah. I definitely strayed away from all that, just in like evasive, like lacrosse ball foam rolling? Because people do not like that. I
Well,
feel.
it's just sensitive. It doesn't mean that there's not usefulness in it. You just have
Yeah,
you have to be selective in your use, right?
for sure. Okay.
Okay.
So I'll definitely start off with that, and then what? So just no front squats or anything at all for now, even if I warm them up with that.
Okay. So where are you going to put their feet to start, and then where do you need expansion? So if you put a barbell on somebody, it may be too much load. You may not be able to capture the position. So again, how much excursion do you have available to you? And are you trying to eliminate interference first? So if I load somebody and I try to squat them and I drive them into a compensatory strategy, how much help did I provide?
Mm.
You see what I'm saying? So it doesn't mean they can't squat. It just means that they're probably going to start with a wider stance. It probably means that you're probably going to have to do like a platform for the foot, because you're trying to drive them towards some posterior expansion, right? And so, where are they? What are they able to access in a squat? Do they break parallel? If they can't break parallel, then you do something that's like a plate squat variation where they're reaching forward. So you get some yielding in the posterior thorax, you get some yielding in the posterior pelvis, but they're still going to be in a wider stance. And then you just slowly bring the stance in as they're able to capture more and more motion in front of them.
Gotcha. Okay, just keep
have to
working.
build it. You just have to build it. Never force people into a position. You just encourage the mechanics that allow them to get there, right? So you start them where they're comfortable, and then you work them back in. They'll be like, you could put a box underneath their hips, right? So they can box squat, but it'll be a wide stance box squat. Chances are you're going to be reaching forward with a plate or something to that effect, right? Where they're reaching forward to help them to create some of the yielding actions that they need to access space.
Okay.
Okay.
I'll do that. Thank you.
All right, dude. I got to go. Good to talk to you again.
Thank you, Bill.
Have a great day.
You too, man.